Hi everyone. Now let's talk about cognitive behavioral therapy. Now cognitive behavioral therapy, or CBT, is aimed at changing sleep habits and scheduling factors, as well as misconceptions about sleep and insomnia that perpetuate sleep difficulties. In fact, the recent National Institutes of Health State of the Science meeting on insomnia concluded that CBT is a safe and effective means of managing chronic insomnia and its effects. Although the best effect is reached when you see a specialist in CBT, we wanted to introduce this technique here and see if you can implement some of the tools to help you with your sleep problems. In a clinical setting, CBT would include regular, often weekly visits to a clinician who will give you a series of sleep assessments, ask you to complete a sleep diary, and work with you in sessions to help you change the way you sleep. The aim of CBT is to change poor sleep patterns and misconceptions, and more importantly, bad habits related to sleep that perpetuate insomnia and sleep disorders. I want to start by saying that CBT is not a quick treatment, but takes time and personalized approach to bring about change. I can definitely say that for us, it has probably been the most successful long-term intervention for many of our patients who are insomniacs. The first step in CBT is starting a sleep diary to see what your personal sleep patterns are like. For example, when do you usually go to bed? When do you fall asleep? And when do you wake up? This gives us one of the most important first pieces of information, which is how much of the night is spent actually restfully sleeping, and how much is staying awake and or dysfunctional sleep. We also capture other very valuable pieces of information, such as naps during the day, eating habits around sleep, drinking patterns, level of physical activity and mental activity around the time of sleep. Once we have the total number of hours spent in bed and subtracted from the time spent awake, we now have the true amount of sleep time. The next step is to decide the time you want to get up in the morning and count backwards from the wake time to determine sleep time. But given that you have subtracted the wakefulness period, the total time for sleep is usually much less. So if we find out that you usually go to bed at 11 p.m. and wake up at 7 a.m., but you spend nearly 2 hours awake, it means you're only getting 6 hours. So now the new plan would mean you will get up at the same time, 7 a.m., but this time you count back 6 hours starting at 7 a.m., which means you should go to bed at 1 a.m. and not to take naps during the day. The idea is to get you tired and get the noise out of your sleep time. There are also other sleep hygiene components such as food diary, as well as environmental adjustments such as light therapy and elimination of light at night. This phase continues for several weeks, and initially it may probably make you feel worse as you may feel sleep deprived, but it is during this phase that you will eliminate interfering factors and limit to sleep time alone. And after a few days of being very sleepy at bedtime, you should find it easy to fall asleep. And that is the goal. Whenever an entire week of good sleep is experienced at 6 hours per night, then we can increase the sleep time by half an hour, by sleeping half an hour earlier. And then several weeks later, if the person is sleeping comfortably for 6.5 hours, we would then increase it to 7 hours. At the same time, stimulus control instructions are implemented by looking at the patient's sleep habits and pinpointing different actions that may be prohibiting them from sleep. For example, not to spend time in the bedroom when you're not sleeping. Leave the bedroom when you're not able to sleep and go to the living room or read a book, and don't return until you're ready to fall asleep. Another part of this process is implementation of sleep hygiene education, which is a customized list of things you should and should not do in order to sleep. We will provide this list to you next week. Some of the things include sleeping in a cool, dark room and avoiding daytime naps, avoiding caffeine, alcohol, tobacco before bedtime, etc. Sleep hygiene education is most helpful when tailored to an analysis of the person's sleep-wake behaviors. Now, relapse prevention is an important aspect of cognitive behavioral therapy. You need to learn how to maintain what you have learned and prepare for the possibility of a future flare-up. You should know that lots of things may trigger a bout of insomnia, and the main thing one can do to protect against a new onset episode of chronic insomnia is not to compensate for sleep loss, start stimulus control procedures immediately, and re-engage sleep restriction should the insomnia persist beyond a few days. The next step in CBT involves addressing those that have running thoughts affecting their sleep. Often, these thoughts are secondary to inappropriate and erroneous beliefs. So the first step is to identify these thoughts, write them down, and this is where the cognition comes in. Where the erroneous thoughts are managed and corrected, and after establishing appropriate thoughts and behaviors over time, the pattern of cognition and thinking is changed during sleep. This aspect may take several weeks to months and may need repeated corrections and reevaluations of running thoughts and abnormal behaviors. Though all of this may seem daunting at first, it is a very effective process and over time can help bring back orderly sleep and eliminate the need for medication. But as we stated earlier, it is always most effective and safe under the supervision of a specialist, either a sleep specialist trained in CBT or a psychologist. We'll see you in the next video.